People who are getting chemotherapy may be at risk for infections because they can have low white blood cells. A white blood cell count measures the body's ability to fight infection. In particular, your loved one's cancer care team will probably monitor what's called absolute neutrophil count, or ANC. Neutrophils are the most common kind of white blood cells and are the first defense against infection. When the neutrophil count drops below normal, this is called neutropenia. Neutropenia from treatment is temporary, but can happen with each cycle of chemotherapy. Radiation therapy may also cause the white blood cell count to drop, but this often depends on what area of the body is in the field of radiation. Ensuring that your loved one is avoiding situations that increase the risk of infection should be a high priority for you. If you are the primary caregiver and you are sick, it's a good idea to ask someone else to take over so you can rest and recover, and so your loved one is not exposed. If that's not possible, it's good to keep disposable masks and gloves around so you can wear them when providing care. Here are a few tips to keep in mind. Always be sure you and your loved one wash hands frequently, especially before and after preparing food, before eating, after using the bathroom, after being in a crowded place, and when tending to another sick person or pet. Ask people with colds or other illnesses to not visit. Avoid raw, unwashed fruits and vegetables, raw or uncooked eggs and food that has been handled by others while your loved one's white blood cell count is low. If there are pets in the home, arrange for someone else to groom them. Empty cat litter boxes and clean their cages as their feces contain bacteria. Drinking about 3 quarts of liquid each day will help flush the kidneys, bladder, and urinary system and will help avoid a urinary tract infection. Good dental hygiene is especially important during this time. Our mouths are a major entry pathway for germs and infections, so by encouraging your loved one to brush twice a day, they are keeping their mouth clear of bacteria. And lastly, since treatments are varied and patients respond differently, be sure to talk to the care team about any other recommended precautions. Fevers are a key sign that there is a problem with the white blood cell count and typically happen when the body is compromised by an infection. They can get out of control quickly, so it's important to know the signs and symptoms and to report it so it can be treated quickly. Ask the cancer care team how often you should check your loved one's temperature and keep a record of readings. Buy a new thermometer that you trust. Digital thermometers are easiest to use, and we recommend avoiding the use of rectal thermometers. Watch for symptoms such as chills, shivering, headache, body aches, rash, or new complaints of pain. When someone's shivering from a fever, the first instinct is to dress them with multiple layers to make them feel warm. While this is tempting, please know that overdressing them will probably overheat them and could ultimately increase the fever and cause more problems. And while it's understandable that they might not have an appetite for anything to drink or eat, it's critically important to help your loved one stay hydrated during their fever episodes, even if it's taking a few sips of liquid at a time. Unless otherwise noted by the care team, if your loved one has a fever, you can give them Tylenol to help lower it. Also, make sure to log when and how frequently the fevers occur, how high it is, any medications taken, and if it went down afterwards. This will be important information to have when communicating with the care team. While there are various reactions to medications and other issues throughout the cancer experience that can be non-urgent, there are certain red flags that are considered urgent and should be reported immediately. Call the doctor if your loved one experiences any of these symptoms: a fever of 100.5 or higher, or a fever that lasts more than 24 hours or goes away and comes back within 24 hours. Shaking chills that last 20 minutes or longer. Chills happen before a person's temperature rises, so be sure to take the temperature when chills have stopped. New cough, sore throat, runny nose, or shortness of breath. Sometimes this is the first sign of the body trying to ward off bacteria. Frequent painful urination. If your loved one has the urge to pee, but very little comes out, and it's extremely painful when it does, they could have a urinary tract infection. And pus or yellowish discharge from an injury or another location. If there is redness around an incision site, draw a circle around it for size and watch to see if the redness expands beyond the marked area. This should be reported to the care team. You should know that the blood counts should slowly get back to normal once treatment is over. The good news is that for most people with cancer, the greatest risk of getting a serious infection only lasts for a limited time. Thanks for watching. For more videos in our Caregiver series, be sure to check out cancer.org/caregivers.